The year was 1984. Mary Lou Retton won gold. Apple released the first Macintosh computer. Teenager Ryan White was diagnosed with AIDS. And a philosopher, a lawyer, and a physician founded the Center for Practical Bioethics in Kansas City. Their goal? Create a freestanding organization to grapple with ethical issues resulting from medical advances and find solutions that directly benefit patients. Their vision? To advance the health and dignity of all people through ethical discourse and action.
It was an exciting time. Healthcare professionals were beginning to realize there were different ethical approaches to their practice, and that the values and preferences of patients ought to be taken into consideration about treatment options.
One of the first issues taken on by the fledgling organization, HIV/AIDS.
Many people characterized it as a modern-day plague. It really caused us to step back and to consider what are the goals of medicine, what are the duties and obligations of those in the healing professions to those who struggle with serious illness.
From the start, the center tackled healthcare's most challenging issues, bringing stakeholders to the table and finding common ground. It was important work that garnered key support from local foundations.
We always thought of the center as a catalyst, both regionally and nationally. Ethics deals with life and death situations for sure, but it also deals with business issues. It deals with personnel issues. It deals with issues that affect people's lives and affects how they do their job. The center has a crucial role to play in this community.
They took all of the research and in a very innovative way found a way to apply it. Thus, the healthcare systems, the hospitals, the clinicians had some practical tools to use in dealing with these very tough issues.
Over the years, the center has launched initiatives to care for those at the edge of life, protect patients while advancing life sciences and research, and promote ethics education and scholarship.
We don't engage in ivory tower debates about theories and principles in the abstract. Bioethics affects all of us, though we often don't realize it till we're in the middle of a crisis. That's where the center stands strong. We're there when it matters most.
Caring Conversations, our trademark program, guides families through advanced care planning, enabling individuals to make their healthcare wishes known. As disease progresses, we continue the conversation with transportable physician orders for patient preferences. TPOP gives patients a say in their healthcare by documenting treatment preferences and translating them into medical orders.
During my daughter's long struggle with ovarian cancer, I learned that there is no advocate in the system to tell you what's going on in a straightforward manner and what choices you have and how you accomplish those choices. And it was during this process that I really came to appreciate, in a very personal way, the work that the center does in providing sound, professional, caring advice in a time when it's desperately needed.
The center also supports healthcare professionals by providing educational opportunities, including a certificate program in clinical ethics and health policy and ethics consultation services.
I think it makes a significant difference of helping the staff be able to formulate ways to deal with tough decisions in healthcare and helping families understand what's best for their loved ones.
In palliative and end-of-life care, patients have a sense of anticipation, a fear of the unknown, and a deep knowledge that life is going to be different from now on. It's both a privilege and a challenge to be a part of those intimate moments. Since medical school, I've relied on the center for guidance. I know that will continue throughout my career.
The center's work in advocacy and shaping health policy goes back 30 years. Its involvement in the Nancy Cruzan case, which ignited the national debate over patients' rights, led to a national multi-year community-state partnerships program to improve end-of-life care. That policy work continues today through initiatives like PAINS, a project designed to change the way pain is perceived, judged, and treated.
I got her breaking up several gang fights in an alternative high school in which I taught. And I went from leading a normal life to not being able to hold my grandbaby or walk my dogs like I used to because of the damage to my hands. I mean, sometimes I felt like giving up, but The Center Pains Patient Network assisting me with my situation, as well as making me a voice to help others. I just thank God they made a great impact on my life. I appreciate them.
The center has a role to play in helping make healthcare, health systems, hospitals, better learners so that we operate more efficiently, and to explain to the public what responsibilities they have to participate in this learning process.
Improving health outcomes by supporting shared decision-making and involving patients in care planning, providing resources for patients living with advanced illness, expanding care options for those dealing with chronic pain. That's the center's past and its future.
Our impact is felt at the bedside locally, regionally, and nationally. But we can only do this work with the help of others who collaborate with us. We made a difference in people's lives for 30 years, and we're going to stay at this work well into the future.
Real life, real issues, real time. The Center for Practical Bioethics.